Breast cancer is detectable and curable in the early stage. Together, okay? Together. Hi, Ching.
Hi Esther, how are you?
Good. What are you doing on a Saturday morning?
Well, we're here. We're both trying to debunk some breast myths.
Yeah, I think that's necessary because the internet is rampant with all these sometimes truths, sometimes half-truths, and it's really difficult to tell the difference.
Correct.
Let's begin by introducing ourselves. I'm Dr. Esther Chuwa. I'm a breast surgeon with a specialty interest in oncoplastic breast surgery, and this is,
I'm Dr. Ching, and we just work together.
yes, happily. Right, so here we go.
The first myth, if I don't have a family history of breast cancer, I will not get it. Yeah, this one is a very common myth, and most people feel reassured because it's not in the family. And while, yes, that does give you a normal risk, it doesn't mean that you have no risk. And unfortunately, only 10% of patients have a family history. So the vast majority, 90%, do not have a family member with breast cancer. And so the important point is come for regular checks. Now it's your turn.
Okay, so breast cancer always causes a lump that you can feel in your breast. Okay, so this is when I need this prop. So this is the breast, right? And this is the insides of the breast. We don't normally get to see the insides of the breast, but we do as surgeons. So if you feel a lump in your breast, there's a high chance, 80 to 90%, that it is not a cancer, because a whole variety of any other conditions can also result in a lump. For example, the vast majority of the lumps that women feel are actually thickening of the breast tissues, especially if it's the time of the month. So that is not a cancer. And other conditions like breast cysts, which are fluid collections in the breast, or non-cancerous benign breast tumors can also result in a breast lump. But however, it's important to recognize that if you are an older lady, you're postmenopausal, and you feel a lump suddenly in your breast, that lump is more likely to be a cancer than if you are in your 20s and you felt the breast lump right before the time of the month. So not all lumps that you feel in the breast tissues are cancers, so do not be afraid to check with your doctor if you're in doubt. Okay, now your turn.
Using underarm antiperspirant can cause breast cancer. Somehow this is a myth that keeps perpetuating, especially over the internet, and it's completely false. So you can wear antiperspirant, you can put powder, you can use perfume, anything. Although there are certain chemicals in antiperspirants which are dangerous, but you don't use it often enough and in enough amounts to make any problems for
Dr. Chan,
yourself.
do you use antiperspirants yourself?
No, I don't. I don't have time.
I don't.
Now, back to Dr. Chua.
Okay, smaller breasts means having smaller or lesser risk of getting breast cancer. Now this is interesting, alright, especially in our sunny island of Singapore, where I think the majority of our women have fairly small breasts. Alright, this is when I like to have some sort of a geographical support. Okay, so this is a world map taken from the World Health Organization, charting what are the relative incidence rates of breast cancer all over the world. All right, highlighting the areas of the highest incidence of breast cancers, for example, in North America, Australia, and certain parts of Sweden. All right, so they have the highest incidence rates. All right, and then let's take a look at the world map charting the average breast size all over the world. So if you zoom in on North America, Australia, as well as Sweden, for example, they don't exactly have the largest breast size. All right, and when you get back to out of interest, okay, which continent or country has the largest breast size? Probably somewhere in Russia, and they don't exactly have the highest incidence rates. So I would say that that's inconsistent. But where we're concerned in Singapore and Southeast Asia, you would find that we have an average incidence. We have small breasts. Alright, the message out there is that if you have small breasts, it doesn't mean that you have a lower chance of getting breast cancer. You can still get breast cancer, so get your screening done. The internet is full of hearsays and myths. Some are truths, some are not really truths. So it's really up to us to be sensible. Ultimately, it is your body.
It's your breast
Breast cancer is detectable
and curable
in the early stages.
So be aware of your body, note any new changes, and do regular screens.